Depth of the Quiet, Chapter 9, Therapy, TikTok, and Pop Psychology, Narratives Gone Wrong. We live in a time when psychological language has become part of everyday conversation, not through years of study, not through clinical understanding, but through TikTok videos, Instagram reels, podcasts, online therapists, self-help influencers, and algorithm-driven content. Your child lives in a world where every discomfort is called trauma. Every disagreement is labeled toxic. Every boundary becomes a wall. Every imperfection becomes abuse. Every strong personality becomes a narcissist. Every parent becomes a psychological suspect. Never before has it been so easy to reinterpret normal childhood experiences as proof of psychological injury. And never before have adult children had so much cultural encouragement to distance themselves from the people who raised them. This chapter helps you understand how pop psychology reshapes your child's memories, language, and identity, and how it can turn a loving parent into a villain with alarming speed. The rise of therapy, talk without therapy. Understanding. Therapeutic words have become viral. Gaslighting, boundaries, trauma response, emotional labor, narcissist, attachment wound, triggering, unsafe, invalidating, toxic, enmeshed, love bombing, inner child work. These words were once used carefully by trained professionals to describe specific clinical phenomena. Today, they are used casually, liberally, and often inaccurately. Your child may use them because they hear them online, they hear friends using them, they feel empowered by the language. It helps them make sense of emotional discomfort. It provides a simple explanation for complex feelings. It fits with what an influencer said. It validates their desire for distance. It aligns them with a community that gets it. Inaccurate use of therapy language doesn't just distort meaning, it distorts relationships, especially the one between parent and child. The algorithm problem, content, that reinforces estrangement. Algorithms don't show balanced content. They show content that confirms your child's fears, resentments, and insecurities. If your child watches one video about toxic parents, they will be shown 10 more about toxic parents, 20 more about cutting people off, 30 more about child victim narratives, 40 more about narcissistic family systems, 50 more validating estrangement, endless content confirming that distance is healing. This is not insight. This is algorithmic reinforcement. It creates an illusion of consensus. Your child believes if this many people are saying it, it must be true. But what they're seeing isn't truth. It is digital repetition. Online communities reward painful narratives. In many online spaces, there's a hierarchy of attention. The more painful your story, the more validation you receive. The more dramatic your narrative, the more support you gain. The more extreme your boundary, the more respect you earn. People who describe traumatic childhoods receive sympathy, admiration, connection, belonging, emotional reinforcement. Meanwhile, people with normal or positive childhoods receive nothing. So your child begins reshaping their story to fit the community they want to belong to, not because they are lying, but because the internet rewards a certain kind of narrative, one that casts parents as harmful and adult children as survivors. When therapy validates only one side, your child may also be working with a therapist who is trained to believe the client's perspective without questioning it. Some therapists listen with compassion, but lack the context to interpret family history accurately. They may assume the parent is the cause, accept the child's memories as fact, reinforce the child's distorted beliefs, diagnose the parent without ever meeting them, misinterpret cultural, generational, or normal parental behavior as trauma, see independence from family as emotional maturity, assume distance equals healing. They often believe they are helping, but their validation, based solely on the child's narrative, becomes emotional fuel. It strengthens the rewritten childhood and solidifies the villain story, the trauma model that doesn't leave room for normal parenting. In pop psychology, there is little room for imperfect parenting, tired parenting, stressed parenting, learning parents, human parents, nuanced parents. Everything becomes pathologized. A parent who set boundaries becomes controlling. A parent who asked questions becomes intrusive. A parent who showed emotion becomes manipulative. A parent who disagreed becomes unsafe. A parent who disciplined becomes abusive. In this model, there is no category for normal parent doing their best. There is only supportive or toxic. Your child doesn't have the tools to interpret the past with nuance, because digital culture erased nuance entirely. Identity through pathology. Many adult children use psychology, not to understand themselves, but to explain themselves. It becomes identity. I have anxiety because of them. I struggle with relationships because of them. I don't trust people because of them. I react this way because of my childhood. My life would be better if they had been different. This is not truth. It is emotional shorthand for, I am trying to make sense of myself, and this is the easiest story. Rewriting the past through pop psychology gives them a narrative that feels empowering, even if it is false. Why these narratives feel real to your child. Your child is not pretending. They are not consciously rewriting history. They are not acting maliciously. They are experiencing emotional confusion, identity formation, influence from others, pressure to belong, algorithmic reinforcement, one-sided therapeutic validation, cultural narratives that reward independence, discomfort they cannot explain, distress they cannot name. The psychological narrative gives them language, identity, clarity, community, justification, a sense of control, a reason for their adult struggles. And once they adopt the language, the story becomes self-reinforcing. What they feel becomes what they believe, and what they believe becomes truth. Why this chapter matters. Parents often feel humiliated, confused, or minimized by the psychological jargon used against them. This chapter restores your footing. It helps you see your child's new language is not a reflection of your parenting. It is a reflection of the psychological culture they live in. A culture that oversimplifies, pathologizes, labels, polarizes, separates, rewards victimhood, encourages estrangement as empowerment. Understanding this helps you stop internalizing their accusations and start recognizing the emotional, social, and cultural forces that shaped their new narrative. This is not your story. This is the language of the world they were shaped by. The next chapter explains how these influences gather momentum and begin forming a new narrative entirely. If you like this content, please like and subscribe to Depth of the Quiet. You can listen quietly at 2 a.m. when your thoughts are overwhelming you, and you may come back anytime you need support. If you want to feel heard, you are welcome to leave a comment or tell me your story in the comments below. This could help other parents that are feeling like they are traveling this road all alone like so many of us do, until we found channels like this one. We all need support on those hard days when the loss hits harder. Start a discussion or ask a question if you feel safe doing so. No pressure to interact. Just heal at your pace, and you're welcome to watch whenever you need to. You are always welcome here. Also, if you like this content, you may purchase the full book Depth of the Quiet by Latina Sidoroff, available in paperback and Kindle version from Amazon.com. And for all the spouses supporting the estranged parent, there's a great book written by the husband of Latina Sidoroff on the spouse's perspective called Standing Beside the Broken, also available from Amazon. The author is Stas Sidoroff. Thank you for watching this video.